We often talk about the big health crises, the ones making headlines, but sometimes the really dangerous threats are quieter.
Absolutely. And today we're looking at one of those silent crises in India, the challenge of antibiotic-resistant infections.
Right. We're doing a deep dive into a recent study from the Lancet Infectious Diseases, which the Hindu highlighted. It's about something called CRGN infections.
Exactly. Carbapenem-resistant gram-negative infections. And, for those of you preparing for the UPSC exams, this is really crucial stuff.
How so?
Well, it touches on public health, policy, governance, all key areas for the mains, maybe even prelims relevance too. It's a perfect example of a current affairs issue with deep implications.
Okay. So our mission today.
Is basically to unpack this study, understand what it found about who's actually getting effective treatment for these infections in India and what that really means.
Got it. So let's jump in. The study starts with a pretty shocking number.
It does. Nearly 1 million cases. Think about that. Almost 1 million CRGN infections in India back in 2019.
1 million. That's huge. But then comes the part that's really concerning, right? The treatment rate.
Yeah, that's where the disconnect is just massive. Despite all those cases, the study estimated that only 7.8% of patients actually received appropriate antibiotics.
7.8%. That's less than 1 in 10 people getting the right medicine.
Less than 1 in 10. It's not just a gap. Like you said earlier, it's more like a chasm.
And the human cost of that gap.
It's devastating. The estimate is around 350,000 deaths. 3.5 lakh people in India, just in that 1 year, likely died because they couldn't get effective treatment for these specific infections.
Wow. That really puts the urgency into perspective. Okay, so let's break it down. CRGN infections, what exactly are we talking about?
Right. So carbapenems, these are a class of antibiotics often seen as the last line of defense for really severe bacterial infections. Powerful stuff.
The big guns, basically.
Exactly. But CRGN means these specific bacteria, the gram-negative ones, have developed resistance to these last resort drugs.
Okay, and gram-negative, what does that part mean?
It refers to how the bacteria react to a lab test called gram staining. It's about their cell wall structure. Gram-negative bacteria have a thinner wall. They don't hold on to the violet stain, so they appear red or pink under the microscope.
Ah.
And that structure can sometimes make it harder for certain antibiotics to get inside the bacterial cell. Examples you might have heard of are things like E. coli, Klebsiella pneumonia.
Yeah, Klebsiella sounds familiar in this context. Pseudomonas, too, maybe.
Pseudomonas aeruginosa, absolutely. These are common culprits.
So how do they become resistant to these powerful carbapenems? What's the mechanism?
The main way is that they start producing enzymes, specifically enzymes called carbapenemases.
Carbapenem-aces. They aze the carbapenem.
Yeah, pretty much. They basically chop up or break down the antibiotic molecule, making it completely ineffective.
Okay, so the drug is destroyed before it can even work.
Precisely. And these CRGN bacteria, they can cause really serious problems. Pneumonia, bloodstream infections, urinary tract infections, you name it. Combine that seriousness with the lack of working antibiotics, and you see why they're so hard to treat.
Right. Which brings us back to that treatment gap. Why are so few people, that 7.8%, getting the right drugs? What did the study say were the barriers?
It pointed to a few key areas. First, insufficient diagnostic testing.
Meaning doctors might not even know it is a CRGN infection quickly enough.
Exactly. You need specific tests to confirm resistance, and if those aren't available or used promptly, you might start the wrong treatment. Second, there's often a lack of standardized treatment protocols.
So even if it's diagnosed, there isn't always a clear, agreed-upon plan for what to do next.
Sort of. Best practices might exist, but they might not be consistently followed everywhere. And finally, there are big issues with antibiotic supply and, crucially, affordability.
Oh, the newer drugs needed might be too expensive or just not available.
That's a major hurdle. Getting those effective, sometimes newer antibiotics to the patient who needs them.
That's a tough mix. Diagnosis, planning, and access. But the study didn't just highlight problems, did it? It suggested a way forward.
It did, yeah. A kind of two-pronged approach. First prong, preserving the antibiotics we do have.
Through responsible use, right? Antibiotic stewardship.
Absolutely. Strengthening those stewardship programs in hospitals and clinics, making sure we use antibiotics wisely. Plus, having stronger regulatory frameworks around antibiotic use in general.
Makes sense. Protect the tools you've got. What's the second prong?
Ensuring access for those who genuinely need these specific drugs, bridging that huge gap we talked about.
So stewardship on one hand, access on the other.
Exactly. Making sure that when a patient does have a confirmed CRGN infection, the right treatment is actually available and can be given to them.
This connects so clearly to what UPSC aspirants need to grapple with: public health policy, healthcare infrastructure, governance failures, and solutions.
Definitely. This isn't just a medical issue, it's a systemic one. It shows how diagnostics, treatment guidelines, the pharmaceutical supply chain, regulate, it's all interconnected. You need a holistic view.
So the core message here, coming from the Lancet study via the Hindu, is this urgent need to tackle antibiotic resistance, especially CRGN, and critically improve access to working treatments in India.
It really boils down to that, and it leaves us, and especially you listening, with a big question to think about.
Which is,
What systemic changes do you think are the most critical? If you had to prioritize, what needs to change first or most significantly to improve access to the right antibiotics for CRGN infections across India?
that's a deep question. Definitely something to mull over, particularly for our UPSC listeners thinking about policy implementation in public health systems.
Critical thinking on that is key.
Well, if you found this deep dive useful, please do like and subscribe for more discussions like this. And let us know in the comments if you have more questions or other topics you'd like us to explore. Remember, today's analysis was based on the Lancet Infectious Diseases study, reported in the Hindu,